I'm Chuck Lazenby, Executive Director of Unity Project for Relief of Homelessness in London. Thank you all for joining us in our online version of UPwithART. It's the 10th anniversary of our annual event, and we, like everyone else living in these times, have been forced to adapt new ways of fundraising, engaging our community, and also supporting our participants. We've shifted our emergency shelter operations to a hotel, prioritizing people who are vulnerable to COVID-19, including seniors and people with pre-existing health conditions. We've doubled our occupancy, but in a space that allows for staff and residents to be safe with adequate social distancing. We've had to learn how to appropriately use masks and gloves and face shields, conduct daily screenings for COVID symptoms, and also conduct our engagements with participants by phone or in the hallway at the door to their room. It's been quite an adjustment for us to have to make, but certainly one we've been grateful to be able to do. Our community has collectively moved very quickly to establish new protocols and procedures for supporting people during this pandemic. From setting up comfort stations to ensuring testing is available when it's needed and making sure that there are spaces where people can self-isolate. We've seen creative solutions to safe supply and managed alcohol for people who use substances. And all levels of government have invested money into supporting our community response. There's been a significant collaborative effort to take care of our city's most marginalized. But London's still in a housing and homelessness crisis. What the pandemic has taught us is that we are capable of quickly enacting broad systemic change. And homelessness and poverty are also a public health crisis. And it's one that demands action, and it's also one that will grow during this time if we don't pay attention and do something about it. If you're experiencing homelessness in Canada, you are more likely to have a chronic health condition such as COPD or diabetes or hypertension. You're also less likely to have access to the necessary health care that's required to treat those conditions. You're more likely to be physically and sexually assaulted. You're more likely to die if you don't have a home. The life expectancy of someone experiencing homelessness in Canada is up to half that of someone who is adequately housed. And let's not forget about the opioid crisis that disproportionately affects people living in poverty. In nearly 4 years, between 2016 and 2019, nearly 14,000 people died from an opioid overdose, with 17,000 more requiring hospitalization. And then, of course, there's a large number of people experiencing homelessness with severely compromised mental health. Homelessness is a crisis that people experience. It does not define the person, and yet the moral and political will to treat it as such has been way too little for way too long. And now's the time for change. I think it's time that we adapt a guaranteed income, one that allows for every person in Canada an opportunity to thrive. Ontario Works currently provides an individual with $733 per month. That's less than half of what we've seen as necessary for people to survive financially in this pandemic. The $2,000 Canada Emergency Response Benefit should be instated as a permanent policy that's accessible to everyone to give every Canadian a foundation for stability. It's time that we recognize the unique mental and physical health challenges that disproportionately affect people experiencing homelessness and poverty. We need to treat substance use as a health issue, ensuring that people have access to a safe supply of drugs and alcohol, expand access to safe consumption, and also have an adequate system of treatment options so that people have the support they need. It's also time that we put a policy in place that ensures housing as a human right instead of the commodity it is today. Safe, affordable, and adequate housing is the foundation to any person's ability to be successful and should be guaranteed for everyone. It's also time that we stop seeing the lives of people without homes as less worthy of our attention and support. I hope this message finds you healthy and well. As we face this time, we're not only needing your support through events such as UPwithART to get us through, but also in paying attention to and advocating for long-term solutions to homelessness. Thank you for taking the time to listen. Please take care of yourself during this time, and do remember to bid generously for UPwithART.
Ta-da!